I'm going to demonstrate a talocrural mobilization manipulation in a supine position. So pretty basic technique. I can try and throw a few pointers out that make it a little bit easier technique to do well. So first what I'm going to do is put my fingers on the anterior aspect of the talus. I tend not to use my small finger just for my own preference, but put the rest of my fingers around the talus. Pull the ankle up into the end range of its dorsiflexion barrier, making sure you're getting a joint / capsule restriction and not a soft tissue restriction of the gastroc. If you're getting a gastroc restriction, what I might do is, can you put this foot under this ankle? Put them in a little bit of knee flexion, and then you can get a better end feel to make sure you're not just stretching the gastroc at the end range. What I like to do too is put a piece of TheraBand or Dicem down to make a little bit more friction between the lower leg and the table. Position the patient where the malleoli are at the edge of the plinth and kind of will block the malleoli from going towards the floor as I push the talus towards the floor. So get your setup where the malleoli are at the edge of the table. Bring them up into dorsiflexion. Again, make sure it's not a gastroc that you're mobilizing or manipulating. And you can give a little bit of an inferior glide straight down, a little bit of a posterior glide, or you can kind of combine them with what's called the J stroke. Then as you pull inferior, you're going to go posterior as well and almost flick the ankle into more dorsiflexion for a J stroke. So Katie, is it okay if I do that?
Yep.
So I can do my mobilization just like so. And again, what I'm trying to do is push her whole lower leg into the table so it kind of sticks on the table, as opposed to being up here where I'm pulling her all the way up to her head. So I'm putting the lower leg on the table and then doing that pull towards my belly and towards the floor, towards my right foot. If I want to do a manipulation in that position, I could hold, do my 10-second pre-manipulative hold. Does that still feel okay, Katie?
Yep.
Any problems?
Nope.
Is it okay if I give you a quick pull?
Yep.
I'll go back to the barrier and pull quickly from there for a manipulation. Then again, I would go back in and reassess the motion, and we're good to go.